While our leaders and healthcare workers continue to receive the vaccine, a new coronavirus strain has been discovered, sending parts of the UK into lockdown. Public health experts, including Surgeon General Dr. Jerome Adams, have reassured the public that the new strain is unlikely to stop the vaccines from working, but that we need to be more vigilant than ever to stop the spread. So joining us this morning with what this really means for us is senior scholar of Johns Hopkins Center for Health Security, Dr. Amish Adalja. As always, we appreciate your expertise. Thanks for letting us check in again this morning.
Sure. Thanks for having me.
So, since this has begun, the virus has mutated 1 or 2 times a month. That's not irregular. Why all of a sudden is this variant sending off all these alarm bells?
Well, what happened in the United Kingdom is that at the same time that they've seen a spike in cases, they've seen this virus mutant, this variation, become much more dominant. And that's putting those two things together. More cases and a new variant is leading them to think, could this new variant be able to spread more efficiently? And indeed, when you look at this variant, it has some changes, some mutations that are, at least in the lab, associated with increased ability to spread. So that's where that came from. It's not been completely proven, and what happens in the lab isn't necessarily the same thing that happens in the real world, as well as the fact that there could be other explanations, the fact that it's winter, the fact that pandemic fatigue is going on, and this strain might have just gotten lucky by where it landed and how it spread. But there's enough danger there that people are taking it very seriously, and I think we're going to need to see exactly what this strain actually means in people before we could say anything definitively. But it is suggestive of the fact that it might be able to transmit more efficiently.
So right now we are assuming that it's more contagious, basically, but we really don't know if it's causing any more severe reactions, right?
Yeah, there is no evidence that this is causing any more severe disease. The issue with the mutations is that maybe it is able to more efficiently spread from person to person.
So we're seeing this lockdown in the UK, almost immediately, right? And then a lot of European countries are also not letting flights. Should we have that same kind of thing go into effect here, do you think? The whole, if it's changing its offense, do we need to change our defense?
No, I don't think that that's necessary. And who's to say that this virus strain isn't already in the United States? Many places don't sequence the way the United Kingdom does, so they don't detect these mutations. And this likely is in other countries, and there have already been cases at least imported into Australia and South Africa, I believe, as well as on mainland Europe. So it's not something that I think is going to be containable through travel bans. I don't think travel bans are ever the solution to any of this. What I think we need to do is continue what we have been doing: social distancing, wearing face coverings, washing your hands. That's what's going to stop this and any other variant or strain of the coronavirus.
So I know I hear a lot of talk about, okay, well, if they made the vaccine based on the initial viral structure of the coronavirus, when that viral structure starts to change, does then that mean the vaccine is going to be less effective?
You have to remember that it takes a long time for a virus to escape a vaccine. It's not something that can happen very quickly. And you have to also remember that vaccines, although they may induce a specific antibody, they induce much more than that. We call it polyclonal, meaning many different types of antibodies get made when you get vaccinated. And you also induce what's called T-cell immunity, a whole different arm of your immune system. All of that is likely to be robust against this virus. They're doing studies, both Pfizer and Moderna right now, to prove that point. But I do think that our vaccines are going to be effective against this strain. And if they're not, there's ways to update vaccines. But I do think that it's premature to think that our vaccines are not going to work. It's an important question we need to answer, but it's not something we should panic or expect to see our whole vaccine process derailed because of these mutations.
So if I'm hearing you correctly, we should probably safely assume that this variant probably is already here, right?
Right. I do think that we don't sequence every virus. When you get infected and you get tested, even with the PCR test, that doesn't tell you the sequence of the virus. There's only a select sampling of those that do. And the CDC does do this type of thing. And we may know by the end of the day whether or not this variant has reached here. But I would not be surprised, not surprised at all, if we have cases of this variant in the United States.
And quickly, just before we go, we hear the headlines. It's scary, right? So on a scale of 1 to 10, how concerned should people be, with 10 being the most concerned?
I don't think they should be that scared at all. I think it's probably around a 2 or a 3 for the general public. Scientists may have a higher level of concern, but remember, it's still the basic things that we're going to do. The same stuff we've been saying since the very beginning of this pandemic. That's what's going to stop this strain from infecting you or you infecting other people with it. So wash your hands, wear a face covering, social distance, try to stay 6 feet apart. All of that is going to stop this strain. So I don't think there's any reason to panic. Let the scientists do the work to determine whether or not what these mutations actually mean in real life, but continue to do what you're doing.
Dr. Adalja, we thank you. Thank you for helping to calm us all when we need it. Happy holidays to you.